Hi, everyone, and good afternoon, and welcome to our webinar. Next slide, please. Again, we want to extend a warm welcome to all attendees this afternoon. This is the New Jersey Comprehensive School Mental Health Webinar Series. This is session 5 on risk assessment. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center in collaboration with New Jersey Department of Education. The Northeast and Caribbean MHTTC is housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Katia Rivera, and I'm the project coordinator of the center. I'll be introducing our center and our webinar presenters for today. Next slide, please. On your screen, you'll see the dates of our upcoming sessions in this series. Our next webinar session will be held on Thursday, March 24th from 3 p.m. to 4:15 Eastern Standard Time. And we will send a link to that registration page if you haven't registered already. Next slide, please. We also offer individual coaching sessions to provide a more targeted support to New Jersey district level teams. During this 1-hour session, our team will assist you in developing your comprehensive school mental health framework and also provide an action plan to guide your next steps. These sessions will be available to all schools and districts on a first come and first served basis by reservation only. All time slots are currently full until the end of the school year, but we are adding names to the wait list. The ones that we have available are the ones that you see on your screen for this Friday, February 25th, from 1 to 2 p.m. and 2 to 3 p.m. I will share the registration link if you're interested in the chat box at the end of this webinar. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Our center also receives supplemental funding to support school teachers and staff to address student mental health, as well as support healthcare providers and wellness and self-care activities. Next slide, please. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen, and it will also be shared in the chat box. Next slide, please. Following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. These surveys are also important because our continued funding is linked to the completion of them. So we thank you in advance for your cooperation. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint presentation within 7 days. Next slide, please. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Miriam Delphin Rittman served as Acting Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Slide, please. We encourage you to interact with our presenters during our webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so we please ask you to use the chat feature to answer those questions. Next slide. Now let's begin our webinar. We have Dr. Lauren DePinto and Mr. Basil Pizzuto with us today. Dr. DePinto is the district coordinator of school-based mental health services for the Ridgewood Public Schools in Ridgewood, New Jersey. She was honored to be selected as a member of the review committee and a contributing author of Chapter 6, Frameworks for Risk Response and Assessment, in the recently published New Jersey Comprehensive School-Based Mental Health Guide. Dr. DePinto earned her doctorate in social work from the University of Pennsylvania School for Social Policy and Practice, a Master of Science in Social Work from Columbia University, and a Bachelor of Science in Social Work and Sociology from Seton Hall University. Prior to her tenure in public education, Dr. DePinto started her career in community-based mental health and psychiatric emergency screening. She joined the Ridgewood Public Schools in 2005 as a school social worker on the child study team before moving into her clinical social work role as crisis intervention counselor, and most recently as the first appointed district coordinator of school-based mental health services for the Ridgewood Public Schools in 2019. Dr. DePinto also maintains a private psychotherapy practice in Northern Bergen County that has been established since 2013. She brings more than 15 years of practice, knowledge, and experience in school-based mental health, school social work, crisis intervention, and clinical practice with children and adolescents. Her general research interests include school-based mental health practice, attachment theory, relational trauma in schools, reflective supervision, staff wellness, and social work education. Mr. Basil Pizzuto is the Assistant Principal for Administration and Student Services at Ridgewood High School in Ridgewood, New Jersey. Mr. Pizzuto has a mathematics degree from Montclair State University, a master's in educational technology from Ramapo College, and a master's in educational leadership from the College of St. Elizabeth. He began his career as a high school mathematics teacher and became a grade advisor at Ridgewood High School in 2002. After becoming assistant principal in 2007, Mr. Pizzuto focused his attention on organizing and leading a student-centered school-based mental health team that was based on relationship-based practices and relational alternatives to discipline. He brings decades of experience as an administrator, educator, student advocate, mentor, and beloved school staff member. As an administrator, Mr. Pizzuto continues to play an instrumental role in establishing a multi-tiered system of behavioral supports at RHS that has expanded across the district. He and Dr. DePinto had the initial honor of co-presenting the RHS school-based mental health model entitled Creating a House That Smiles, Optimizing School Culture and Climate Through Relationship-Based Practices at the 2019 Annual Conference on Advancing School Mental Health in Austin, Texas, and again at the virtual 25th Annual School Mental Health Conference in October of 2020. We want to welcome you again, and I will turn it now to our presenters.
Sorry about that. I was on mute. Thank you very much. I think it's a good time to get started. Thank you for that wonderful introduction. We're here today to talk about risk assessment, and to understand a general framework for how we assess risk, how we engage students and families, and how we put policies in place to guide our practice. So what is risk and why should we assess it? Risk is an all-encompassing term. I think in education, as well as in mental health, it is very broad. And so for the purposes of today, risk means responding to a student or a group of students in distress during an emergency because there's an immediate crisis, or there's a personal safety situation or issue at hand, or when the student's demonstrating or being observed exhibiting concerning behavior. And so there's a spectrum to understand. risk. But I think that it's very important to know that for the purposes of risk assessment and response, students are placed at risk because there are a number of factors in their lives that pose as barriers to learning and also just impact their overall mental health and well-being. A multi-tier system of support is the framework that is going to guide any solid and effective and efficient response program. And here is an overview of the intensive, targeted, and universal sort of supports, key strategies, and partnerships. I think, MTSS has been a huge part of the success in our own district and has helped us really communicate across tiers. So we really don't miss students as much as we can. We're talking at different levels, we're talking to each other, and it's fluid. And that's a really important aspect of risk assessment and response. At tier 3, that's obviously the most intensive supports. That's the school clearance, that is the crisis intervention. That's also special education and related services, intensive family supports. Tier 2 is really about short-term targeted interventions. But I think in terms of risk assessment, because that's what we're talking about, that really is a part of every tier. And if we work very hard as districts, as teams, whether it's site-based or building-based, district-based, it's about tier 1 and tier 2 being strong enough to then sort of reduce risk for intensive supports that are needed. Nevertheless, it's important that all 3 exist. One of the other pieces here that I do want you to pay attention to, or that is important to me, is that schools, really need to partner at every level. Every single level, they need to partner with students and families. They are present and they are key stakeholders in the success of any program. And I think that it's very important that they know that, and that's demonstrated, but that any establishment of protocol or policy, which we'll get into, really includes their voice and includes an accurate assessment of their needs. And we'll talk a little bit about that moving forward. In terms of best practices, that's what we're here to talk about today. I think one of the most important things for me as a practitioner, but as a school-based mental health provider, whether that's a school counselor, school social worker, school psychologist, school administrator, nursing professional, psychiatric staff, is that risk assessment is relational. You cannot have a thorough assessment, or you can't thoroughly engage, assess, and intervene without a relationship. And I think that we're in a human services profession. Schools are, the de facto mental health system, which we all know, and any intervention is about relationships. They are interchangeable. And that is really where we have to kind of look at the theoretical approach to how we actually practice from an evidence-based perspective. Some basic best practices here, like I had mentioned before, screening should be a part of a comprehensive MTSS program. If that doesn't exist, that's where you start. Do we have this program? Is it clear? Do we have a framework? Risk versus protective factors. We can't have a conversation about risk without truly being able to operationalize what risk factors are, what protective factors are, and how we can look for them at the student level, the individual level, the family level, and the community level, because that's going to help the framework of how we accurately intervene and most sensitively intervene. I think in terms of definitions, it's important to remember that the protective factor is defined by SAMHSA, as a characteristic at the biological, psychological, family, or community, including peers and culture level, that's associated with a lower likelihood of problem outcomes, or that reduces the negative impact of a risk factor on problem outcomes. That's important to note because conversely, a risk factor can be defined as a characteristic at the biological, psychological, family, community, or cultural level that precedes and is associated with a higher likelihood of problem outcomes. So you can't have one without the other, essentially, but we have to know what we're looking for if we're going to address them. We need protective factors to buffer against risk, but we need risk to bolster what protective factors are designed to do as human beings in growth and development. Families and students should be involved in planning and implementing screening at every level. Like I said, they are key stakeholders in whether what we decide to do actually works. We need their voice and we need their input. And we also need to understand, depending on district, depending on demographics, depending on the specific culture and climate of our buildings and our districts, they need to be involved. School-based mental health screening practices should always prioritize accuracy. We'll talk a little bit more about that. Privacy, confidentiality, safety, and follow-through. Follow-through is incredibly important because it's a very sensitive process. And follow-through is a demonstration, right, that that child matters. So some basic steps in establishing a screening process. Before I start with the steps, I think it is important to acknowledge that you need to know what you're screening for. Screening is also a very broad term. And so when things are broad, it's important that as practitioners, as team members, as school administrators, we start to distill what it is that we're looking to screen for, right? Getting specific. And if they're screening for, general at-risk issues, whether that's, grades, attendance, truancy, that's one piece. If we're actually screening for depression, that's a whole other set, right, of measures. And so it's important, like I said, to find what you're screening for, and it could be at different levels and for different things. We can do, universal screeners at tier 1. We can do more targeted screening at tier 2, or we can do much more intensive screening at tier 3. So before we can do anything, though, we need a foundation, we need a team. A multidisciplinary team is where to start. That includes school psychologists, right? School-based mental health providers, school social workers, the nursing staff, administration, any key stakeholders, special education teachers. I mean, we're all in this together, and the more voices you have with different specializations, the more accuracy is going to be involved in putting together a framework for your buildings. Clarifying goals, identify the purposes and intended outcomes. What are you looking to screen for? What's the outcome we're looking for, and how do we get there? Identify resources and logistics. Timelines, identify staffing and budget resources, develop administrative policies. It's important to kind of look at what's within our ability, right? What do we have access to? Is it feasible, right? We want to make sure that all of these things are at least a part of a checklist that you would use. Selecting an appropriate screening tool. This could be informal or it can be formal, but it's about having a unified approach to selecting this tool and being able to kind of start the process, have everyone bought into that process, understand how the process works, what their roles are, right? Defining what their actual job tasks are as a part of this team, and then moving forward to step 2. As in any formal, certainly, but even informal screening process, we need to determine consent and assent processes. That means that parents, again, comes back, I think every slide, I'll come back to this, parents need to be involved. Families need to be involved. Students need to be involved in terms of consenting to participation. And I think the last step, obviously, is develop data collection. What are we doing? How are we doing it? And follow-up processes. Now that we did this, what's next, right? Screening is measures in this protocol is really only as good as what our long-term plan is, right? What's year 2 or 3? And then what's next and how do we build on that? Understanding risk assessment and crisis intervention. There are 2 really big key takeaways, right? Obviously, we can have a whole other webinar on both of these things, just to talk about the in-depth nature of all of the work. But it's important to know as school professionals that not all risk assessments or students identified in acute crisis require a referral to the local emergency room or psychiatric facility, right? We still need to, within school-based mental health especially, look at the least restrictive environment, right? From a strengths-based perspective, what's the least restrictive environment to meet the needs of said student and family? And I think that that's a good sort of basis to determining the communication protocols. Frameworks for response include communication protocols. This will be dependent on your buildings. This will be dependent on resources available. But it is important communication protocols exist. This includes who, what, and when, right? Who needs to know? Who in the chain of command is required to know the sensitive information? Let's not forget that confidentiality matters most here, right? Who's required to know? What does the Board of Education policies in your district dictate, right? What information do they need to know? And in what form? Do they need to know specific details? What's outlined in board policy? And then when? At what point in the process is the information shared? And so more specifically in schools, this means something is presented, we need to think on our feet, right? About what's required to tell someone, usually an administrator, and what do they need to know? And at what point in the evaluation, at what point in the process do we tell them this information? And these are things that really, again, need to be developed as a team. Teaming and collaboration are, paramount to success in any school-based mental health endeavor. Certainly, as you're developing a strengths-based relational model for risk assessment and response. So, triage and levels of risk. I think that this is a very important and critical part of this presentation. And again, this is more of an overview because I think there's a lot to talk about in terms of how you go from low risk, moderate risk, and high risk. It's important to know that having a severity index is critical. And by that, I mean a spectrum. How do we understand what's presented, what the presenting problems are, right? How do we understand how the student's demonstrating distress? Low risk, not urgent, tier 1 intervention, responsive, light support, right? Moderate to urgent, tier 2. That's very targeted support. It's very specific and it's acute. The student's demonstrating or is reporting, high levels of mood or behavioral difficulties or distress. Alternative teachers could be bringing said student to you as well, right? I think in schools, we move at such a fast pace that there are a lot of pathways that students come to us. And then I think it's important for us to understand what are we dealing with? And if you look at it in a way that categorizes it, it helps you kind of have a framework, right, for what action is needed. High risk and imminent danger, that's very clear. That's crisis intervention. That is that said student is in distress and is in need of a school clearance or is in need of a visit to the emergency room, right? That's a very clear high risk, imminent danger, tier 3 intervention. Again, I kind of touched upon these, and these are just some ideas. There are a number of things I think we all do every day that kind of fit into here, but these are just some examples based on the severity index as to what you might do in response for a student and family. Provide community resources. If a student is coming to you and they need an outpatient referral, that's something we can offer. Responsive relational discipline practices. A large part of any school-based mental health program and risk response framework is really about looking at our whole discipline chart, right? How do we discipline students? It has to be relational. And that's a huge piece of what we'll talk about in terms of the district exemplar, because that's really been the framework for how we do things in Ridgewood. Offer consultation to students, teachers, that's huge. And you can do that at every level. I think partnering with teachers, because they're on the front lines and they have the most contact with students, is the best vehicle we have for looking at a tier 1 sort of understanding of risk, but also it's an opportunity to educate people, teachers, in mental health literacy. And that, again, it comes by being able to partner with them and having an established sense of trust. Low to moderate, level 2, low to moderate interventions. Again, it kind of includes all of the tier 1, but then there's a little bit more, right? And that's developing a resource plan. Once a student's brought to your attention, there's an opportunity for an ongoing relationship. It's not sort of like a one-time experience. Now the follow-up happens. Now the relationship happens. Now the counseling can happen in a different way. And that can include an actual plan. Identifying protective factors and pro-social supports in school. I think oftentimes kids need to be able to kind of visualize that. We need to be able to identify those things so they can rely on those when they're in need, but they can also look at, ways of coping through using, whether it be staff in the building that they trust or other protective factors that they identify as a way to cope. Tier 2 interventions that focus on skills, coping skills, are a huge opportunity to provide response. So weekly meetings with students to monitor social and emotional health, but also their symptoms, right? We need to see them. We need to get a sense of where they are post issue that brought us together, right? Family support, outpatient referrals. Again, I think a large part of our work is partnering with families, but also partnering with mental health agencies, community mental health agencies, county agencies, private practitioners, and other collateral contacts to be able to have a network of mental health providers that we trust and that we can work with and we can refer to. I think it's very important, certainly for today. And again, this is just an overview in terms of looking at like the dimensions of student mental health and how to determine the severity index, the level of threat, but what we really need to look for, right? What we need to be mindful of as we're having these relational conversations with students and families. Mood, behaviors. Again, this is kind of a recap because I touched upon this. So I'll go through it a little quicker. And if anyone has questions, you can let me know, or we can talk at the end. But these are things to kind of visualize in your own checklist about where to look and where to pay attention to the verbal and nonverbal communication. Again, mood, behaviors, risk and protective factors, levels of stress and distress, substance use and misuse, social and cultural supports, family and home environment, history of bullying or harassment, suicidal thoughts, plans, or gestures, mental health history, access to resources. It's important that we have mental health history. So not for any other reason except to really truly understand the context of what's going on. And that's really helpful as we decide, okay, maybe this is more severe. Maybe this is a tier 2 intervention. Maybe this is a crisis intervention. And getting this information is critical to an evaluation. General triage and student assistance protocols typically include, the research supports this, but this is also kind of in terms of my own practice, how we've generalized our approach. And that includes responding immediately, where, a large part of our school-based mental health program is the direct access to adults immediately and as needed. And that's going to be huge in terms of having a safe space or bank of offices that's confidential, that's child-friendly, that feels safe, that literally the proximity of the office and how it's set up creates a sense of safety. Keeping the student secure, right? That's paramount, obviously, depending on how we understand any sort of threat or concern, certainly at the beginning. Then getting into a conversation, assessing for the level of risk. This can include a formal or informal measurement. An informal interview is the best first step, right? In kind of including all of the other elements I just talked about. And we can talk a little bit later in a future slide about maybe specific measures. And I know that in the New Jersey Comprehensive School-Based Mental Health Guide, there's a chapter devoted to suicide assessment. And there's a number of different vetted resources that we can use to more formally assess for risk. The next step is determine appropriate action. This is really about what action is necessary. And we determine what action is necessary when we have a relationship with the student. We have a solid assessment of the biopsychosocial aspects of the student's situation. And we also understand context. Then that will help us also inform the appropriate follow-up action plan, which is necessary. Clarify student reentry guidelines. We'll talk a little bit more about that in another slide, because reentry is very, very important about helping the student seamlessly transition back into learning. And documentation. And documentation really is any set of policies, protocols, or paperwork that we determine is the way to keep track of all of the actions taken and kind of how we organize the work. Some basic steps, and again, this is best practice, this is a recommendation, would be, like I had said, to create a site or district mental health intervention team. At Ridgewood, one of our successes has been the creation of a mental health intervention committee, which started grades 6 through 12. And now we have plans to kind of bring to the K-12 school-based mental health support team. And a mental health intervention committee is really made up of multidisciplinary practitioners, administration, school social workers, school psychologists, nurses, special education teachers, regular education teachers. So we have a shared interest in knowing what's going on at every tier of service, but we also have the information we need to understand what we do and when we do it. You know, it's this team that can create the language that your school is going to use to create these protocols and policies. And that's an important part of this. The next, and I think I talked about this, but a visual aid is so important because we literally want a step-by-step action plan. You know, what do we call crisis or what do we call risk? What do we do when this happens, that happens? Literally a chain of command where we can pick it up and we can look at it and we know exactly who to access. I think it's also important too, if we don't have access to that, sometimes because of the nature of working in schools, it's very hard to get caught up or distracted. And that's why policy and protocol really, even if it's a framework, is so important and is a large part of what administrators, and I've been lucky enough to have my administrator be a part of our policy, but it's what administrators can really do to help guide their buildings and, you know, kind of keep the work efficient and really the most effective. So just some quick notes on screening tools. The information collected, obviously, from any screening tool is valuable insight into a student's well-being. I think it's very important, though, that we consider whatever tool we're using, we do it with fidelity, we have training, and we also are, you know, we focus on confidentiality. And that's a huge piece because mental health, school-based mental health, and any interventions related to this is very important that we prioritize confidentiality and they're very clear about where we're actually keeping any records. If you refer to Chapter 6 in the New Jersey Comprehensive School-Based Mental Health Guide, you will see an outline of the 4 of these tools. These tools are recommendations. Obviously, there are a number of other ones, but I recommend that you take some time and go through Chapter 6 so you can get a little bit more of the context to what I'm trying to get through in a very short period of time. And the brief intervention for school clinicians is a very good tool that can be helpful in implementing a framework for assessment and response. So, reentry and transition. This is a very important aspect of risk assessment. And I think sometimes we don't pay as much attention to it as we should. But I think if a child is experiencing any sort of distress or is hospitalized for some reason, whether it be mental health or otherwise, quite honestly, in this case, mental health, it's important to understand what, you know, the dynamics of what that experience feels like and how it might impair their ability to learn and how it is incumbent upon us to, right, develop a plan that's going to help them seamlessly and comfortably come back to school. Because at the end of the day, school-based mental health is about removing barriers to learning and doing our best to support, you know, a child's right to education. And it's very hard to get into the classroom and to meet the demands of school, of homework, of anything related to the task of learning if you're dealing with an internalized or externalized, you know, set of circumstances. And a reentry meeting can be an incredible opportunity to partner with parents, to show that you really want to build a relationship with them, to show that you care and that together you're going to make accommodations, temporary or otherwise, as needed to support their return to school. Typically, these are some recommended steps. Meet with the family and student. I think that's the first step, right? Is having an in-person meeting. As of right now, obviously, I'm doing this during COVID-19, so there are some accommodations we'll have to make. And if it needs to be virtual, that might be the only option. But a meeting is first priority, ensuring the appropriate releases, right? We want to partner with collateral contacts or treatment providers who can give us insight into what it is that we need to do in school, right, to help ease transition back. But that is obviously only with the permission of the parents, guardians, and student. It's very important as part of the reentry plan to designate a go-to in the building, whether that is a school counselor, guidance counselor, administrator, coach, school-based mental health provider, case manager. It's very important to have a go-to adult. That go-to adult obviously is there to provide support and understanding, but is also there to help communicate with teachers, to help communicate with the larger staff in terms of what the child's needs are as an advocate. It's also important to assess missed work, right? I think it's very important to consider prioritizing what work we need to do, what work we could waive based on what a child needs. And by doing that, we implement appropriate modifications. We inform the student and family of the supports and services in schools, which are voluntary. And, we adhere to the best we can, right, to the extent possible as a partnership to the recommendations from treatment providers. But more importantly, we start to train staff that are involved in the student's life. And I think that that's a huge piece in terms of advocacy, is helping staff understand student within the confines of confidentiality, and help them understand how they can approach the situation most sensitively. And monitoring is key, right? This isn't just a one-time intervention. This could be a years-long relationship. This could be, the start of something very important for a child. Teaming, related to risk assessment. Teaming is like I said before, and I will say it again, teaming has been responsible for the successes that I've had as a crisis intervention counselor for decades, but it also is the best way for us all to get on the same page. Risk assessment is a relational endeavor. Risk assessment really, I want to demystify it, right, if I can, because I think sometimes we get very caught up in the necessary aspects of the evidence, right, the paperwork, the policies, the protocols, which are very important. But what's more important is that we work together with one interest in mind, and that is what's best for a child. And, constantly talking to each other, having team meetings, making sure that they're in our schedules, right? I have a weekly GA team meeting for this reason. And we'll talk a little bit about what a GA is a little bit later, but collaboration, coordination, and communication are critical to doing something for a child that really is person-centered, student-centered. But it's a way to get everyone on board to work the most efficiently. A note quickly on community engagement. It's luckily, we have a partnership with CarePlus New Jersey. We have a Tier 3 support program, which has been instrumental in helping us really meet the Tier 3 needs. And I know they're in different districts across the state. But as a part of our connection to CarePlus, Perform Care New Jersey has been a huge asset and resource. And the Chapter 6 does outline a lot of these community services in greater detail, but look to Perform Care, mobile response and other screening services as outlined to be supportive in the process. Partnerships are critical to risk assessment and response, both in district employee school staff as well as the services that we contract with, but they also have access to 24-hour care and consultation to help us create policy and programming. Again, family engagement is critical to any program associated with risk assessment and response. And risk assessment and response is really a part of the larger school-based mental health program, but families are essential to partner with, and they also are essential in the safety of our students, but it is also our job to really help families and communities when necessary and where necessary, get linked up together so families who need support have access to support. As a social worker, this is probably the most exciting part of the chapter that I wrote, and such a necessary component of any training regarding school-based mental health, but certainly regarding risk assessment. And some cultural considerations that I think are necessary, if not vital, for us to have a part of our everyday practice would be engaging in self-evaluation. To build cultural self-awareness, we need to understand ourselves before we accurately understand others. It is our jobs and our district's jobs to improve cultural and racial literacy and provide opportunities for that. It is necessary in this work to apply culturally responsive micro skills and engage the student and their family, to establish support or an access or circle of support that's really culturally relevant and meaningful to them. And in terms of crisis response, I've outlined, a couple of different steps. Obviously, this is in much greater detail in chapter 6, and I think that you would find additional resources that can be helpful. But, culturally competent crisis response includes identifying specific culture-related needs of the community. You need to understand that in order to meet those needs and meet students and families where they are, not where we want them to be. Maintain a current profile of the cultural composition, right? Identify formal and informal resources. Identify them, certainly when it comes to crisis intervention and risk assessment, we do need to identify the meaning of suffering, pain, and death. And we need to anticipate and identify possible solutions that really speak to cultural and linguistic competency, which is a good segue into staff competencies, obviously. And, for this particular chapter and this assessment, we all kind of come to the work with our own training, and each discipline has, its own specialization and own training associated. But I think more than that, it's very important that staff really focuses on building a therapeutic alliance. So those competencies, I think, start with clinical competencies, counseling competencies, truly understanding how to use the therapeutic alliance to engage, assess, intervene, and also, evaluate. Those are critical. But at the very end of the day, it's really about positive value, personal credibility, and permission and protection to engage in exploration and change. And a large part of what we do at Ridgewood, and we'll talk about it a little bit later, is really use theory, right? And adapt it for practice. And the PACE attitude for practice, which was originally a part of the dyadic developmental psychotherapy, DDP. It's really about relational trauma and addressing relational trauma. But a large part of that theory, which I'm not going to get into, is about an attitude for practice. And the PACE attitude is really about engagement in every aspect in schools, whether it be with staff, parents, families, or students. It's about being playful, right? Accepting, curious, and empathic. And I think that having that as a foundation for risk assessment is really where we need to begin in terms of our response. So the following are just a couple of team reflection questions that you can think about now. Certainly consider bringing back to your teams, bringing back to your buildings, bringing back to those you consult with. And, considering you're experiencing processing triage, conducting risk assessments in your everyday work, what qualities or skills do you feel help you meet those needs? Because I think we often meet those needs, and we have a lot of skills that, if shared, it becomes a huge resource bank of collegial support. But conversely, what qualities or skills do we have to develop further to broaden our repertoire of responses? What are whole school culture and climate factors in our buildings that affect student learning and impact students' place at risk? It's important to do a needs assessment and kind of really understand that, just with curiosity, not even judgment, but just curiosity. What are we doing well, and where are the openings for us to start to improve? And how do we understand or currently address the diverse social, cultural, and language needs of students being referred for assistance in risk assessment? That is a critical aspect of a whole student, whole school approach to risk assessment. So at this point, I will hand it over to my administrator, my mentor, and a very close friend who has partnered with me, obviously, to discuss the Ridgewood Public School District as a New Jersey district exemplar.
Well, thank you very much. I want to start by saying, well, introduce myself. I'm Basil Pizzuto. And I'm going to start by saying that, watching Lauren go through, her chapter 6, that, we as an exemplar, have a lot to be proud of, but we have a lot of work to do. So, listening to Lauren speak, we have areas to work on. So I think that we as a state will move together and do this together. And just to kind of introduce myself, I'll start. Well, first, apologize for the way I'm dressed. I'm actually on a school trip. I'm chaperoning a trip overseas. This has been a trip that's been postponed since before COVID, and really following through and making sure the trip that these kids were excited about happen is kind of like who I am, but then also being here for, this mission that we believe in, even on such a trip. I just didn't have enough room in my luggage to pack a suit. So I'll start with that. And I had this interesting, before I go into talking about the school, just an interesting thing that somebody observed me as, I was talking to the teacher who's with me on this trip, and, talking about this presentation. And she had, paid attention to a conversation that we had over dinner with the students. And we have 16 students, and they're high school students, and many of them are in their senior year. So the students were kind of talking about senior pranks, and they started going after me about different pranks they had, ideas, and reminiscing about senior pranks they had in the past. And I shared with them information about the pranks and even some pictures that I had of some things, but then I kind of followed up with the other side, some of the experiences that we had with some of the bad stuff that happened. And the way I approached the students was to really meet them where they were at, and not just shut down the conversation, but really listen to them and then give them something to think about. And that conversation went on for the better of 15 minutes. And this teacher, a good friend of mine, Anjali, who's with me, pointed out that really listening to students and engaging with them in an authentic way is really at the heart of what I'm going to talk about tonight. So I leave all the technical stuff to Lauren, and I'll talk about our team, because that allows me to lean on people like Lauren for those technical things. But to build a team that just cares about kids is really what we're talking about. So a little bit about the district. It's made up of a number of schools. I work at the high school. I'm primarily a high school employee, but I have been working very closely with the middle school principals and the elementary school principals to create a K-12 comprehensive multi-tiered model for mental health. So that's been really exciting, and we have really grown. I've been in my position since 2007, but really I've been in it since 2002, and I'll talk a little bit more about that. Basically doing the same thing, and I like to give the credit to the people that came before me, and then also some key administrators that did hiring in such a way of not just looking for people that wanted to go into administration, but people who were kid-centered, student-centered, to be in key roles was something the district was dedicated to. So people like me didn't just move through the position to moving on in the career. My career grew over the years in the position I'm in. And so I thought that's a unique thing. So we have 2 middle schools also, and then 6 elementary schools. We're located in Bergen County. It's a, upper middle class town. We have a population of 1,782 students, staff of 200. And we have a long tradition of demonstrating a progressive school culture, beginning with an open campus in the 1970s. And that was due to a building construction project where they had the students spread out throughout the town. So this idea of an openness campus goes long before my time there. And a unique student management structure set up in the 80s. I'm going to use this word, grade advisor, and numerous student freedoms based on mutual respect and trust. And our number one belief in Ridgewood is that self-regulation and self-direction is the best form of student management, and one we foster and believe in. So we trust our students. We encourage our students to take care of themselves, but we're there to support them through that. So a little bit about how we grew our mental health program is during the 2000s, the grade advisor team, which existed since the 1980s. And I'll just explain what a grade advisor is. It's a key person in a class's life at the high school. So when they come in as a freshman, that goes through to senior year. You take your class through the senior year. So I, in my position as an assistant principal, remain as a grade advisor, and I have a class. So I'm now the sophomore GA, and then I will stay with them to graduation. So from the day they walk into school to the day they walk off the field and into project graduation, which I stay with till the next day, I am with them through it all, the thick and thin. So that includes discipline, attendance, class activities. We don't split this into, well, one teacher is in charge of class activities and they run the prom, and one person's in charge of discipline and another person's in charge of attendance. It's all one person with a team around us to support that person. And then we have a team of 4 people that really work closely together, and we also share students because the students' lives are intertwined. So it's a very unique position, and it's one where you really get to know the students, through all of their ups and downs, their joys and their sorrows. And I think that that's the number one thing in terms of risk assessment, is really knowing your students. This has been copied into the middle school, where middle school guidance counselors or school counselors follow a loop like that, where they follow a class through in one of our middle schools. And so it's really been a unique thing. And it's really about a student-centered relational approach when addressing discipline and attendance. We really move toward. So everything we do in terms of discipline is about the relationship. We do still have traditional things like detentions, and we have school suspensions and out of school suspensions, but we always start with, this is an opportunity to get the student to know the student better. We rarely use out of school suspensions. If we do, we partner with Bergen County in a suspension alternative program, which links the student to further services. And it's been a fantastic thing for those students that need to be out of school. In 2006, I want to just go back, Lauren, for one thing.
Sure.
That the part where we like coupled with and you'll probably have to speed me along because I could talk about this stuff forever, but I'm sorry. So
get going.
I didn't rush you, don't rush me. You used all of my time. That's what this is really about. So we partnered with a psychologist, a local psychologist, who really brought the psychological lens to a lot of stuff we're doing. And then we thought it was really important to have psychologically and social work minded people on our team. So we hired an LCSW, followed by a second year, another LCSW, worked in the middle of high school. And the model with these people is that we are in an authentic relationship. So I do not refer students to Lauren, to Dr. DePinto now. I refer students to our team. We're a part of a team. So we meet every 4 days and we talk as a team, all the grade advisors, all of the mental health support people, and we talk about kids and we talk to each other. We're a team. And that relationship is so important. It's not just about relationships with the students or relationships with the community. It's about the relationships with your team first, because that's how you build the support network. Several years later, we moved on to bringing in tier level 3 services, and now we contract with Care Plus that provide that, but also the Care Plus provider is an equal part of our team and has a voice on our team in terms of helping students.
And if I can just add quickly, because I do think it's relevant to this in terms of training, is not only the tier 3 provider a part of our team, but in addition, the clinical staff, LCSWs and other clinical providers have weekly supervision as well. So we carve out time to really get, clinical about our work and kind of really assess our work. So it's meetings, it's relationships, but everyone is a part of the team. And I think that's huge.
And we don't just talk about student problems. Like when we're talking about things like the upcoming prom or the incident that happened last week that has a disciplinary action associated with it, the mental health professionals in the room have a voice. It's not just, well, we're going to refer a kid to you. They have a voice in the whole thing. So the addition of clinical staff members helped shift the district's understanding of student service behavior and helped set the tone for how we understand and respond to student risk. This mental health focus across multiple domains has evolved and expanded over nearly 2 decades. And this is really about mental health. I liked in Lauren's chapter, talking about, we're not always talking about mental illness, we're talking about mental health or the lack of mental health in some cases.
Right.
So in terms of risk assessment, I just want to overemphasize, obviously, Lauren talked a lot about what to do when kids are identified at risk and then getting those connected to services. But you cannot identify kids at risk if you don't know what's going on in their lives. So the relationships our staff has with students, professional relationships, but real authentic relationships where you really know the students and foster that is really important, so that when a kid is at risk. And we have some other things in addition to just the relationship, the piece, which we'll get to. But we want to increase positive connections between adults and students at all levels of learning. And this says Ridgewood High School, but all through the continuum from elementary school through. Obviously, I think that what we've done at the high school is kind of approach more of how we approach kids like we do in the elementary schools with the classroom teacher that really sees the whole child. And then we built in supports at the elementary level with having a guidance counselor on staff, with having access to people like Lauren who are professionals in their field to support them.
We just have to
So there are a
keep,
number of, yes?
yeah, let's just, because I want to get to the end of it, but just want to, are you okay if I move that forward?
Yeah, no, that's fine. I'll jump in. So things like, meetings are important. The structure is very important. Time for people to have access to adults. So we have this thing called Period 9. After school teachers in our classrooms are waiting to meet with students. And it's split between students needing help in their subject area or students needing support. We had a situation where we had administrators call students to really talk to them and find out what they're doing. And that student, that relationship found out that certain kids were going to teachers in their Period 9s for the support over their time at Ridgewood High School. So in addition to, the relational piece is to use technology, and many of the districts, I'm sure, are using these type of tools, but online safety software systems. So we have not used straight out screening tools yet, and that's an area we're looking into to screen students for mental health, but we are very active at using things like our Gaggle system, Lightspeed systems, GoGuardian. These are various software products that look at how students are using the online platforms that we have, identifying students, and then that makes us connect to those students and then have those conversations that Lauren was talking about. So we do have challenges, when you go to a kind of a system like this, is getting staff buy-in and getting staff on board. And that took time. It takes a lot of conversations, again, through relationships. It also gets done through professional development. Shared understanding of student risk, that we do talk to each other about how we identify that this student is at risk, and we have a shared belief in that. Something called symptom cultivation is something that was brought up in the years past with the psychologist who's working with us, and that is many schools cancel events if it has any negative student behavior. And we want to keep having our students have memories, make memories. I'm in a foreign country now with students, then yes, there is always a risk that a student might behave poorly on a trip like this, but those students are doing these things outside of the school anyway. And having a place where we can hold the student and get them help that they need is a really great thing. So that's an area to look at. Service overlap it's a good thing, but it's also a challenge, because in our schools, students don't always know who the school counselor is versus their grade advisor versus the administrator who's very, involved with them. And sometimes they don't know those things. And that service overlap does sometimes need some teasing out that, this person's going to do this for you and that person's going to do that. And then the more you dig into students' lives, you're going to get a compassion fatigue. You're going to find out more, and then you're going to own that. And that's the part of being a team and having the supports of each other to get through those hard times. So we have many successes. a lot of increased interdepartmental communication, and that our mental health staff across the district has really been moving forward and meeting monthly. Open access to adults in the building. Like we said earlier, we have open campus at the high school. Students are free to come to adults, walk in their offices, hang out, talk to them, and that open access is very important. Streamline access to direct mental health intervention for students, staff, and families. So we do offer our, through our website and through also meetings that we have, offer a lot of connections that our students know what supports there are. We had a shown decrease in student clearances and hospitalizations and disciplinary actions over the years. And then, of course, the creation of our position of school-based mental health coordinator to help coordinate all this. Because I do believe that, my background is in math, and I do this as a labor of love, but it's good to have key people in positions that know the protocols, know what we should be doing, and always consulting as a constant with those people so we know what we're doing is best for kids. So a few lessons we learned. Everything we do is about the relationship with the student, what's doing best for the student. Adopting an attitude that's playful. Lauren talked about the PACE model, being playful, accepting, curious, and empathetic. We make decisions that's best for students and not always for the staff. And that's some of the challenges, because staff likes us to do things that they want us to do. We always have to say what's best for students. And team members, regardless of discipline or training, believe our interactions can be healing as much as a protective factor in the lives of students. And that's always a tough one. Dr. DePinto talks a lot about rupture and repair. That's those students that you have a rupture with, that you need to repair that relationship and show them that you're still a strong factor in their life, and that that you're not just putting them away because they did that and throw them away. It's really important that you're still there for them.
Absolutely. And I think just to add, I think one of the benefits is that we look at risk as an opportunity, right? We look at behaviors as communication. And it's been, I think, key in getting us to work together to listen to what
we believe that everything a student does, everything they do, they're telling their story, and they're looking for you to listen to it. And
Right.
So having the student talk more, it allows them to tell you more instead of doing these things that are these negative things around you to get that attention.
Okay. So here are a number of resources. Again, I selected those that I think are most appropriate to today's discussion, but there are many more in the actual chapter. And there are a number of different pieces of information, data points, research articles, as well as like really great tools. The School Mental Health Referral Pathways Toolkit, if you haven't downloaded it, if you haven't read it, that is the one thing I recommend you definitely do. It is incredible. And it's current. And so, take a look at some of these resources that are available, because there are a number of resources at our fingertips. And I think it's time for questions and answers. So.
Yes, I want to thank you so much, Dr. DePinto and Assistant Principal Pizzuto, just for such an inspiring and informative presentation. We have a few questions, and I also want to encourage anyone who has some questions just to type them in the Q&A box. And I'm going to start with one around an assessment tool for assessing potential homicidal risk. Would you have any suggestions for that?
Specifically for homicidal risk?
Yes.
So more recently, I don't have the screening tool right in front of me, but there are newer tools that we are using. And I believe the Department of Justice disseminated current literature that outlines certain points and specific questions regarding homicidal threat for school providers, an inventory and actual interview list. And Basil, did you want to speak up? We went through that as a team.
I mean, the thing that goes to my gut is anything at that level of risk, teaming is the most important thing, and having a lot of voices in the room, and not just using a screening tool, but really having a number of people with a lot of eyes in different areas of a student's life and even in the professional world. When we've had those level concerns, we've actually partnered with out of school professional people that had specific degrees and experience in those areas and hired them to work with us through those hard times, and also to have a good partnership with the police.
In addition, though, and absolutely, but there is, I think, within the past couple of months, recent, a new tool that has been disseminated that really just helps to ask specific questions. So we're all on the same page in terms of asking the right questions, the more specific ones.
Thank you. And so as another question, we have a question around what steps you might have taken to address the challenges related to staff buy-in and compassion fatigue.
So that was more probably my area in terms of buy-in, and I'll leave it to Lauren for compassion fatigue. So what we did was we created courses for teachers that were voluntary. So we didn't force them in the room, and we offered it at different levels. So we did it for middle school and high school, and we called it supporting at-risk students. And teachers came because they thought, oh, I care about the at-risk students in my classrooms. And we just use it as a forum to share stories and have somebody with like Dr. DePinto's expertise to kind of explain, what was going on. And slowly that got the ball going and that get those teachers interested to the point where we've now run summer programs as part of our professional development, where we offer a number of courses in supporting students in these ways. And we have a lot of, so many teachers signing up that we've had to turn people away and put them to some of the other stuff that we're doing. But it's a slow process. And I would say it took about 10 years where teachers just accept the way we are. When I first started, they were like, I just want the assistant principal to wag their finger in the kid's face and get them to stop. Where now they're bringing the students saying, I'm concerned about this student. And we don't have that, like, I just want the kids suspended and out of my room. It's really, the culture's changed, and it's starting the ball slowly rolling. Compassion fatigue, Lauren?
Yeah, well, that I'm trying to think about the best way, right, to capture what I want to say, because I think first and foremost, compassion fatigue is real. And I think we need to acknowledge it. I think the work we do is really, really tiresome, certainly now more than ever. But I think a way to get around that, or what's worked for us and what's worked for me, is really about time spent, right? You need to develop trust with people. You need to develop trust with teachers, that you say what you mean and you mean what you say, and they know they can rely on you, like any relationship. And that's really, I think, the return on that investment has really yielded the results, to Basil's point, where now it's about trusting the team, right? Instead of expecting from the team. And when people feel safe in their workplace, when they feel like they have reliable supports, that in and of itself reduces or serves as a protective factor against buffering against compassion fatigue. But I think also incorporating and really making a very clear statement from a district perspective that staff wellness matters and it's an imperative, and we're going to do things to bolster staff wellness. We might not get it right, but I think the first step is the only step that really matters. And it's about having that visible to people so they know that, not only do they have supportive relationships from colleagues, administrators, but that the district actually is investing in different ways that makes their workplace stress or compassion fatigue more manageable.
Thank you. And again, we see the importance of building relationships, and also, the emphasis on the process, that these things take time. And I appreciate those comments. So I think we have time for maybe just one more question. And this is around parents and parent engagement. And how have you managed relationships or situations with parents who refuse or are slow to engage with the school regarding a student's mental health and associated risks?
Well, we're going to end with a very challenging one. The thing about it is that it's very difficult to get parents to always do what you think they should be doing. And we also have to be sensitive that we're not always in their situation. We don't fully understand what they're going through, and we have to be mindful of that and not come across as being judgmental or anything like that pushes them further away from the school. So I will talk from a practical standpoint, is that we will go through hoops to make it manageable for them to be able to link. So that means, you know, if it means having the font, you know, and I know that there's people in different situations in terms of their work, but for me personally, you know, if I have to talk to a parent later at night, I will do it. If, you know, if I, you know, to being open to what their needs are in terms of that link. But if they're not linking, being always mindful of whether or not there's a line being crossed that we need to get, you know, protective services involved, DC, PMP, or if not, you know, if it's not that level, then to really support the students and then tell the parent what we are doing. So I've had parents that didn't want to come in, they did not want to do that. So we tell them we're offering these services and we follow through and just continually communicate with them what we're doing, but support the student, even though the parent's not linking in.
Yeah, I would add to that, you know, that is an inherent challenge in our work, right? And that should be expected. And I think for me, again, it is really about understanding or adopting a philosophy of people that helps you understand who they are, so you actually know how to work with them, right? How to see what some of those barriers are. And honestly, it comes down to trust. You know, if a parent, you know, or family can trust, even if circumstances, like I said, every district's different. There are a lot of factors and things that people are up against. And it's incumbent upon us to understand where, like, the existence, the ideology of that resistance, to not necessarily, you know, reject the resistance, but to understand it and to figure out adaptive, person-centered ways to meet a person where they are, meet a parent where they are. I mean, you know, we have to have certain assumptions. I'm not into assumptions, but in this case, I am. And we have to assume that parents are trying to do the best that they can. And in cases where that might not be the case, or cases that homes or families, you know, kids might be exposed to risk, it is still a part of our process, our teaming process, to figure out the best, most compassionate ways to help a family improve the conditions that they're in. And a lot of times schools can also be a risky place for them. Schools, you know, are designed to be, you know, a healthy place, but sometimes, you know, we have to be open to the fact that we have to get or think about ways differently to engage more of a resistant parent or family. And I think that trust, mindset, understanding, and just persistence, not giving up. Don't give up.
And
You
I
know,
just
it's
want to
really where
throw
it's at.
just two more things that I thought of is that a lot of times that the parent might be having some of their own experiences at school come through, and it's like kind of a school fear based on their own circumstances, and to always be mindful not to shame the child of what their parents are doing.
Yeah, and again, I think it's really about ongoing dialogue. And I know it seems general, but everything comes down to the team that you're working with, you know, and being able, quite honestly, even though this maybe isn't specifically related to the answer to your question, I don't want to leave this program without really making it clear that as subject matter experts, right, it is a part of the teaming process to challenge the team, right? And Basil and I can talk for hours about those experiences, but it's important to not just go along with the team. We're there to share ideas. We're there to share different perspectives. And sometimes we need to recognize that maybe our course of action isn't necessarily the most helpful, or that we're missing a piece, and relying on the team to build trust with each other and the families, I think is really a process that's worth investing in.
Thank you. Thank you so much for your thoughtful responses. And
Thank you.
right now
Thank
we've
you.
run out of time for questions, but if anyone has any additional questions, please feel free to reach out to our center. And I'm going to turn things over to Kati now, who's going to discuss the evaluation portion of our webinar. Thank you.
Thank you.
Thank you, Alicia. So as a reminder, our center is funded through SAMHSA, and as part of receiving this funding, we're required to submit data related to the quality of this event. So if you do have your mobile device handy, you could hover over to the QR code that you see on your screen, or access the evaluation survey by clicking on the link that will be shared in the chat box. I will also email everyone the link to the survey in case you do not have a QR code reader at the moment. So that will be sent in an email. Next slide, please. And we're also excited to share with you our newest product. It's a podcast called Toward Wellness and Recovery. And you can find this either on Spotify or Apple Music or by using Podbean. And the focus of this podcast, it's called Flourishing at Work, a helping plan for helping professionals. It's on self-care and wellness for all who are in the helping professions. So we hope that you also find this enjoyable. Next slide, please. And if you have any other further questions for our center, you can contact us at our email. Right now, we are still working remotely, so phone isn't the best, but email is where we are the most responsive. You can also follow us in our different social media channels on Facebook, Twitter, and LinkedIn. And if you are not subscribed to our listserv, email listserv, you can do so by clicking on the link that was shared in the chat box for our listserv. And again, I'd like to thank our webinar presenters for today, Dr. DePinto and Mr. Basil Pizzuto, for guiding us through this important topic with all of our attendees for today. We hope that you continue to stay safe and well. As a reminder, a webinar recording will be posted on our website as well, because I keep seeing this question in the chat box. So just wanted to make sure everyone has that information. Again, we hope that you continue to stay safe and well, and we hope that you can join us at our next webinar next month. Thank you, everyone. Take care.
Thank you so much.